we are going to look a little bit at the back anatomy. So I got my model over here, which is the vertebra column, not the spinal cord. A lot of people in the beginning, basic anatomy, confuse that. The spinal cord runs through there. All right. So just a quick overlook of the vertebral column. So at the top here, you've got your cervical spine, which consists of 7 major vertebrae. All right. All right. The first two is the atlas, and then it is the axis below that. All right. And then you got 5 more cervical vertebrae. After that, you got your thoracic vertebra. That's your chest area over here. Okay. There are 12 of them. And then you got your lumbar vertebra, the thick ones down here, 5 of them. And then you've got 5 sacral vertebrae, but these are fused, ending with your coccyx. Okay. As you know, they've all got intervertebral discs that allows for shock absorption. And then obviously there's nerves running out alongside of them as well. Now, with um, with the muscles surrounding the back. Um, Now, there's a lot of them. We will take a look first at some superficial ones, the ones that we can see on someone's back from behind. All right, so the major ones we'll look at is the trapezius muscle, which is the thick muscles here in the neck, and it runs down between your shoulder blades, aka the scapula. It's the anatomical term. All right, and then between the scapula, you also got your rhomboid muscles, which are visible as well. And then you got your latissimus dorsi, which is the thick back ones, runs all the way down here to your pelvic area. All right, insertions and origins of the muscles we will go in depth in future videos, but for now we're going to keep it basic. All right. And then you've got the thoracolumbar fascia also crossing here that sends feedback to the rest of the body. All right, now just to quickly touch on the posterior muscles of the shoulders surrounding the shoulder blades or the scapula. So we're not going to go too in depth with it because the shoulder is a whole different complex area by itself, but you can tackle most of the muscles of the shoulder because they are located posteriorly. Okay. So as you know, you got the front, the anterior deltoid, the mid deltoid, and the posterior deltoid, which also forms part of the back. So those muscles are the muscles of the rotator cuff group, which is your supraspinatus, infraspinatus, subscapularis, and your teres major. You also got your levator scaps, levator meaning elevate, lifting your shoulder blades or scapula up and down. Okay, they are there as well. All right, and then you got your teres minor as well, which is not as visible, but people with an atrophied teres minor will normally have a bit of a slouching forward or a kyphotic position, so just for future references. Okay, now the back has 3 layers of muscles. You've got your superficial muscles, the ones we just discussed, the ones that you can see. All right. You also then have your intermediate muscles. They come in with a lot of backs or vertebral columns stabilizing. All right. And then you got your deep layer muscles, which helps with the movement of the spine. Now, as everyone knows, the spine can flex forward, it can extend back, it can side flex, meaning bend sideways, and it can rotate. Now, when people stretch, they always, because the muscles of the lumbar region normally get stretched when they lie on their backs and they do some sort of a rotation, they think it is the lumbar spine rotating, when in fact it's actually the thoracic spine rotating. The lumbar spine doesn't rotate, the pelvis rotates. Okay, just FYI. And so let's look at some of the intermediate layer muscles. So with the intermediate layer muscles, you got your quadratus lumborum, all right, and they are basically, if I turn around, located here, okay, and then with them you also, or slightly above them, you got your serratus superior and inferior. Superior as in supra as in top, inferior as in bottom. Okay, so they run up and they run down. But in a nutshell, so that is your serratus posterior. You also have your serratus anterior. Now these are muscles that help your ribs to move up and down and helps with contraction and expansion, hearing, breathing, and all that. A very very important muscle also to keep strong in the long run. Okay, and these can all be tackled with compound movements, which we will discuss later. Um, so those are the two big intermediate layer muscles. Now you also have your deep layer muscles. Now a big one to remember is your multifidus. Now your multifidus runs alongside your spine all the way over here. Now it helps with extending back and flexing the spine sideways. All right. Now we'll come back to the multifidus. You also have your longissimus, which is long muscles running here at the side. You have your semispinalis. They run up towards the back of the neck, which also in turn has your splenius capitis, which is these muscles that you can see in the back of your neck. I forgot to touch on them earlier, which also is also back muscle. So you can see it's getting pretty complicated. So I'm going to try and make it as simple as possible, like I did with the knee last week. Um, to get back to the multifidus, now it is extremely important to keep the lumbar or lower back part of the multifidus strong, okay, because this is a muscle that atrophies quickly, and studies show that it is one of the biggest culprits of mechanical lower back pain. All right, as that part of your that part atrophying. To strengthen it, we'll come back to deadlifting later. But deadlifting is, especially for those gym rats that like heavy lifting or power lifters or Olympic weightlifters, is a very very complex thing. We're not going to go too heavily into that. I'm just basically going to teach you how to pick something up and down from the floor. But if you want to keep these muscles really strong, adding a deadlift will is crucial in the long run, especially for the older generation. But we will get to that when we get to the exercise part. Okay, so that part of the multifidus, very very important to keep strong, because it does atrophy over time if you are deconditioned or if you don't exercise and move a lot. Okay, now the quadratus lumborum, which is the two muscles, the beef jerky muscles here at the side, they require training as well. All right, that will be mostly done through extension, like the bridge we've discussed a couple of times on this channel. The bridge is something everyone, I think, should do, young, old, anybody should be doing bridging. Very very important, and they work in conjunction with the glutes, and they are also important along with the lumbar multifidus to keep strong. All right, and then as we move up, the trapezius muscles, like I said, you've got the big ones here in the neck. That is your the superior trapezius muscles, and then you can go down to the inferior trapezius muscles, which is um, very important also for the upper back to keep strong, because to avoid kyphosis, which is that forward slouching, that forward stooping, which used to be only common with older people, but since we are moving into more flexion dominant culture because of modern technology, a lot of people as young as 15 tends to suffer from that forward hunch position. So those are important to keep strong. but they can be overtrained. So the antagonistic muscles below them, the latissimus dorsi, the thick ones, are very important to be exercised as well. All right. Then another important tool will be your rhomboids, which we discussed earlier. So you got your rhomboids major and your rhomboids minor. So again, that's top and bottom. Okay, don't overthink the planes, because again, that is future videos. So we will discuss that later. They are extremely important to be trained as well, because they are the ones that help with pulling your shoulder blades or your scapula together, and then there's other muscles in the front that help with pulling them apart. Okay, and then we've also got the levator scapula. Name obviously says it all. So the best way not to overthink these Latin names is to think on the planes they move in, or the ranges they move into. So this will make sense in future videos when we start throwing more of that in as well, okay? Because a lot of people, especially those who are new to exercise, need to understand these to exercise the right way, and not facilitate any muscles that are stiff, already stiff, anymore, and make it any more stiff, okay? So levator scap, levator elevate meaning lifting your shoulders. That's what the levator scap do. And again, the latissimus dorsi and the muscles of the external rotators, again, those bring it back down. All right, so that basically is the muscles of the back. Now, coming back to the deep layer muscles of the erector spinae is another one I didn't mention, that run alongside here. I think that's the only one I didn't mention yet, and that basically keeps your spine upright. Okay, and the best way to exercise them again is lifting something off the ground, and to strengthen or lengthen them, or help decompress the spine. Hanging from somewhere is another good way to do it, and then obviously you can, if that doesn't help, you can consider coming to our clinic, and we can mobilize these for you segmentally between the vertebrae, but that requires manual therapy. All right. So yeah, erector spinae. Now the erector spinae and the multifidus, they are in conjunction with the quadratus lumborum, and the QLs, as the abbreviation is called. They help to stabilize the body as well. So, exercises like the plank and side plank, and obviously your bridge is very good to train those stabilizer muscles, and again, to help keep the spine upright. All right. Muscles of coming back up to the top of the neck, muscles of the splenius capitis. So that's if I turn around again, that's the muscles here that tend to tighten up, all right, over time. So you'll see people with a forward-headed posture, when they lie back onto their back, these are normally shortened and these are lengthened, so their head is always looking up there, okay? So those are important to keep loose. I've done exercises on those before. While lying on your back, you do the head knots without lifting your head off the floor. The best exercise to keep that loose. Everyone should, at least at some point, add that, or especially if you're a desk jockey and you work behind the desk. All right, now muscles and spinal column aside, let's move on to some exercises. Okay. Now, we're going to look at basic hip flexion exercises, which will help strengthen the antagonist muscles of the back, which is the abdominal area, or specifically the transverse abdominis, which is more deep layer. Your rectus abdominis is your actual six-pack, or your keg that you can see. All right. So the best way to train that basic, young and old, all right, will be lying on your back like this. All right, there will be a video online with these, and detailed as well. Basically lie like this. You can either press your lower back into the floor. If you feel your back is not happy with this, just relax it so there's a small space between your lower back and the mat. But try and keep your ribs down. Don't let the ribs protrude, okay? Especially those are stiff, might have that problem. So basically, very, very easy. Put your middle finger and your forefinger here on the soft area here on your abs, just above your groin area. And you're going to lift one knee up, all right? And then keeping this one still, you're going to lift the other leg up. You should feel a lot of things going on here, all right? And then you're going to bring one down, keeping the opposite one still, and then the other one down. Okay? You're going to do that about 10 times, switching, starting with the one and with the right, and then starting with the left. Okay, so that's a really basic hip flexion exercise. Again, in the past videos, I have done things like the dead bug, where you move the opposite arm and opposite leg. Okay, that involves contralateral movement. Very, very good exercise to work your transverse abdominis as well as your axial sees back. But again, that requires a little bit more flexibility and mobility, and those are more for slightly more advanced athlete. So for basics, just do the alternate knees. Okay, now let go in. While we're on our back, we're going to go into rotation. Rotation, very, very easy. I've done this before. I like the one with one knee over the other, so you got some internal hip rotation as well. Okay, but you can do it nice and basic, especially if you have tight hips, just with the knees together as well. All right, that one or that one. Again, 10 per side. You can either, if you got the knees together, you can either do one side, stopping in the middle, and then the other side. Just don't do anything random like this. And try and keep the knees glued to each other. So one glute will lift up and one foot will lift up, because you don't want them sliding off each other. If you do it cross and you've got the internal hip rotation, you obviously going to do just one side and then the other side. You obviously move towards the side that is on top. So in this instance, you're right. Okay, you're gonna do left on top, you move to the left. All right. So that just brings some hip mobility into play. But the knee side to side is a very, very good one, because you can do it anyway on your bed in the mornings, and it's really nice for the back. Now, extension. As obviously, you can work on your bridges. I've done a lot of videos on those. I like the glute one with my feet flexed. Okay, but if your knees don't like it because your feet are turning out, then obviously you can keep your feet flat. It's just as good. The problem with the bridges, especially with people starting out, is you can get extreme hamstring cramp there. Now, to bring the lower back or the thoracolumbar fascia into play that we discussed earlier, the fascia is that cling film over the muscles that send feedback from one muscle to the other one. You can do it lying prone or on your front. Again, just make sure, just like you did with the alternate knees, you want to keep your ribs down, and you want to keep your chin slightly tucked with your head down. All right. Now, you can lift the leg individually until your glutes are stronger, and then you can eventually lift both. Okay. That's to avoid the hamstring cramp. You can also do it with a bent leg, and that works more on the hip flexor mobility. But I like this one, again, for that thoracolumbar fascia, to strengthen that for better feedback between the muscles. All right, now, second last exercise, or third last one, we're going to look at side flexion, which is kneeling. Okay. Now, the best way to do this is slightly technical, but you can go with feel with this one, especially if you are stiff on the side, is to kneel down like this, if you can. Bring your hands to your sides, and if you're wearing shorts, that's fine. If you're wearing trousers, that's fine. But find the seam here at the side, and you're going to slide your middle finger down the seam until you can touch the floor, and then bring it up. Now, things to watch out for, obviously, is forward flexion. and too far extension. All right, so try to follow the seam. That's the best way to do it. That's how I do it. And one side will feel tighter. Now, this is great because it doesn't just loosen up the obliques, but it loosens up that serratus posterior that I was talking about, as well as that quadratus lumborum. Okay, because this is a good, really, really good stretch for that. All right, so you can lengthen while you strengthen. Okay, I am not a big fan of doing it standing with dumbbells. It just becomes too complex. There's different ways of doing it, I think. Um, to add resistance, you can just go deeper, or you can hold a side support or side plank. Okay, again, we've done videos on that before. Okay, now quickly to go over deadlifting. Now, studies show most people injure their lower back, especially city dwellers, at the airport, pulling luggage off the carousel, heavy luggage, quickly as well, in a weird position. So basically what you want to do when you pick things up, and this is just in general, it's not just for the deadlift as an exercise, you want to bend the knees. And then whatever you're lifting, remember this for yard work as well, those of you that have yards and like to do gardening, and then pick it up. So if you would pick up a box or a pot plant like this, if it is really heavy, try to look straight ahead. You don't want to look too far down because, again, that can make those discs protrude, especially if your back is deconditioned. And this you can integrate into daily life, especially if you don't do some sort of manual labor where you work in deliveries and you're lifting boxes, or you work in a warehouse, because it's a great way of just making the deadlift a daily practice. Okay. Now, like I said, I'm not going to go into the intricacies of the deadlift. Because we don't have weights or barbells here, which is the best way of doing it, or with a kettlebell. You can do it with dumbbells. Again, I'm not a big fan. You have to do it under supervision because it's a very technical exercise. But it is one, lifting things up from the ground is one of the best exercises to train that lumbar multifidus that starts to atrophy with age, like I told you about. And that is one of the biggest culprits nowadays for mechanical lower back pain. All right. You have a lot of patients, you send them for an MRI. The MRI comes back clear, but they still have back pain. And research shows you, it's not foolproof, they're still doing research on it, but most research shows you it's because of atrophy of the lumbar multifidus. All right, so those are your exercises. Now, for mobility, we'll quickly go over segmental mobility, so loosening up between the vertebrae. I like to use a peanut, so you can purchase these at your trigger point balls at our clinic. Okay, you can also use 2 tennis balls, and you just pop it into a sock or an old stocking, and then you have your peanut. You do not need to buy those sophisticated CrossFit peanuts from the web. You can if you want to, but it's really easy to make, and those ones tend to be hard, so they tend to be much more for athletes. Now, you can, where you feel tight in your lower back, you can put it between those vertebrae on those erector spinae muscles, and you can just lie on it, all right, and then move it down or up your spine accordingly. Works great for the thoracic spine, the upper spine area of the thorax, and obviously for the splenius capitis muscles here at the back of the neck, to loosen that up, lying on that. Okay, you can also do it, the head knots on them as well. So it's great. You can move down onto the lumbar spine with these. The thing is, though, if you have pain in that back, in your back, when these are pushing into your lower back, it's best to maybe leave it and just discuss it with your physio first before you're going to embark on that. But for the thoracic spine, upper spine, this works great. So nice makeshift peanut, and you can add that to your repertoire of exercises. Okay, so that's for mobility. That's all in a nutshell. And so that kind of wraps things up for the back. Like I mentioned, the back is very, very technical, neurologically as well. A surgeon once told me that there's so much of the back that we haven't discovered yet, needs to be discovered. So In future live streams, we'll go into the back in more detail. Um, so, like I said, that basically wraps things up. So please don't forget to like and subscribe to our social media and to this video. Also, in the link there, there's a link to my upcoming webinars as well. So you can click on that. It should take you there for you to subscribe to that as well. And come and watch where we go into a little bit more detail on back pain and how to avoid surgery. All right. Um, any questions, please pop them in the chat box. And aside from that, I will see you next week, and I want you to have yourself a good week and stay safe and healthy. Take care.